Diagnosing Organizations. One definition and importance of diagnosis. Organizational diagnosis is a systematic process used to assess the current state of an organization, identifying strengths, weaknesses, and areas for improvement. Much like a medical diagnosis, it is essential for understanding underlying issues and determining effective interventions to improve organizational health and effectiveness. The purpose of organizational diagnosis is to gather relevant data about the organization's structure, culture, processes, and performance, which can then inform decisions that lead to better alignment with strategic goals. Diagnosis is crucial because it provides clarity on the root causes of issues, allowing leaders to make informed changes that address these underlying factors rather than only dealing with surface-level symptoms. In organizational development, diagnosis forms the foundation for any planned change initiative, as it guides the design of interventions and measures the impact of those changes on the organization. 2. Organizational level diagnosis. Organizational level diagnosis examines the entire organization as a system, including its strategy, structure, and overarching culture. At this level, diagnosis seeks to understand how well the organization is aligned with its external environment, such as its market, competitors, and broader industry trends. Key elements assessed include the organization's mission, vision, core values, and strategic goals, as well as its design, such as hierarchy, communication flow, and resource allocation. An organizational-level diagnosis can reveal whether the organization's structure is helping or hindering its ability to respond to external challenges and achieve long-term objectives. Additionally, this diagnosis often includes evaluating the organization's culture to determine if it supports collaboration, innovation, and growth. When the diagnosis identifies a mismatch between the organization's strategy and its operational structure, leaders can make structural adjustments or cultural shifts that better support the organization's objectives. 3. Group-level diagnosis. Group-level diagnosis focuses on the effectiveness of teams or departments within the organization. Since organizations operate through the work of groups, diagnosing issues at this level is essential to understanding collective performance. Group-level diagnosis assesses factors such as group cohesion, communication patterns, and decision-making processes. It also examines the relationships between groups, identifying any interdepartmental conflicts or silos that may be inhibiting collaboration and productivity. A major component of group-level diagnosis is examining group norms, which are the unspoken rules that guide behavior and interactions. If groups have established norms that promote trust, open communication, and mutual support, they are likely to be more effective in achieving their goals. On the other hand, if norms encourage competition, avoidance of conflict, or lack of accountability, these behaviors can undermine group performance. By diagnosing group dynamics, OD practitioners can design targeted interventions that foster teamwork, improve communication, and address group-level challenges, ultimately enhancing overall organizational effectiveness. 4. Individual-level diagnosis. Individual-level diagnosis examines the experiences, behaviors, and motivations of employees within the organization. It is focused on understanding how well individual roles align with organizational objectives and whether employees have the necessary skills, resources, and support to perform effectively. This level of diagnosis considers factors such as job satisfaction, role clarity, workload, and the alignment between individual goals and organizational goals. Another important component is assessing the motivation and engagement levels of employees, which are often influenced by factors like recognition, feedback, and growth opportunities. Individual-level diagnosis is critical because it sheds light on specific factors that directly impact employee performance and well-being. For example, if employees feel undervalued or overburdened, it may lead to disengagement and higher turnover. Through individual-level diagnosis, organizations can identify and address issues related to job design, reward systems, and training, creating a work environment that supports individual growth and aligns with broader organizational goals. Overall, diagnosing an organization at multiple levels, organizational, group, and individual, allows for a comprehensive understanding of its current state and the identification of specific areas for improvement. This multi-level approach ensures that interventions are appropriately targeted and can lead to more sustainable changes that enhance the organization's health, efficiency, and alignment with its strategic vision. Through effective diagnosis, organizations are better equipped to implement changes that drive performance, employee satisfaction, and long-term success.